It's important if we wish to win the battle, to follow them. I've been told that people more and more are taking the 1 to 2 meter distance between people. That is the most important. That is what has to be done. And if we do that, things are going to go well. So, I wish to give you the numbers. Unfortunately, we have 2 more deaths. So we are now at 8 deaths in total. And I wish to offer my most sincere condolences to the family and the people close to the victims. We now have 1,629 confirmed cases, an increase of 290. 106 people infected who are being hospitalized. That is an increase of 28. We have 43 people in intensive care. That is an increase of 8. The people in intensive care are included in the data for people being hospitalized. What is important to say is that right now, Quebec is one of the places in the world where we've done the most screening tests when you look at it proportionally. So by 100,000 people, we're now at 36,000 tests. 31,800 were negative. 1,600 positive, and we have 2,600 right now where we are awaiting results. I wish to come back to a point that is important and which was talked about yesterday, especially in the media. So the protection of healthcare staff. First, I wish to be very clear. There is no question of compromising in any way whatsoever on the precautions to be taken to protect the healthcare staff. But every country in the world right now is keeping an eye on the usage of the masks because there are concerns everywhere that if the increase continues over the next few weeks, we are going to be tight with our supplies. So it's really important, and we're working very hard together with the federal government, with suppliers everywhere in the world. But we have to use the masks judiciously. So on the one hand, we want to protect them, but using masks when it is not necessary doesn't help anyone. Because yes, every country, not just ourselves, every country is trying to be careful with the consumption of masks. Now, I have together with me today the Minister for Labour, Employment and Social Solidarity, because we really have an issue, and I'm very conscious of it. A lot of people have lost their jobs. A lot of people end up with financial problems. Without explaining the program that was announced yesterday by Mr. Trudeau and the federal government, what I understand is that everyone who has lost their job is going to be getting $2,000 per month, even independent workers, even owners of an SME that had to close down. Everyone is going to be getting an amount of $2,000 per month from the federal government. I understand, however, that the difficulty is what do we do in the meantime while we're awaiting that $2,000? I've been hearing stories that are not acceptable in Quebec, that there are people who don't have money to pay food for their families. So we are going to set up measures in order to, first of all, we have about 30 food banks. There are food banks in every region of Quebec. We've already started sending them money, and we will be sending all the necessary money in order to be able to respond to the needs. There is no question that anybody in Quebec will not have something to eat. So that is very clear. And of course, we have to expect that there will be more people in food banks. And I wish to say to Quebecers, don't be embarrassed to go to a food bank. It's not your fault if you've lost your job in the last few days or the last few weeks. So there is no reason to be embarrassed to be going to a food bank. We're going to make sure that there's enough money to buy all the food that is necessary. And of course, you can see what I'm going to say, we're going to need more volunteers. So later, Jean is going to explain to you, we've set up a portal over the web where, on the one hand, organizations that need help, I mean, there are food banks, but there's also all sorts of other problems. You know, some people have health problems, mental health problems. So Jean is going to be talking about that. So all organizations that are lacking volunteers are going to be able to write up their needs in that portal, and all Quebecers who wish to volunteer and who can volunteer, well, today, this is my call to all today. So all Quebecers who don't have symptoms, who are younger than 70 years of age, who have time available, who don't have young children or whatever, who have lost their job, well, please go do some volunteering work. It's important. And my daily thanks is to those volunteers. So I wish to tell you there's already a lot who are doing volunteer work. I'm thinking amongst others, and I want to say something special, everybody working in cities, municipalities, whether it be the elected officials, the employees, there's a lot. I'm given very good examples of people who are going out to help in food banks and different organizations. So thank you from the bottom of my heart to all volunteers in Quebec. However, and before Dr. Arruda says it, wink, it's important that volunteers who go in those organizations respect the guidelines. What does that mean concretely? I'm thinking about food banks, for example. There can be a lot of people, so we're going to have to control things so that there are no gatherings. So you have to wait in line with a distance of 1 to 2 meters between each person. Of course, those who will be serving have to wash their hands often. That is very, very important. And that is the main guideline. It can't become gatherings, you know, community organizations and centers to receive all sorts of food stuff and help. So I would like to end by saying I think that it is not an exaggeration to say that right now we are experiencing the greatest fight of our collective lives in Quebec. We are able to win this. We will win this fight. But in order to be able to, we have to follow the battle plan. And so I count on you to follow it, to follow our guidelines. Thank you, everyone. A few words in English.
We have to stop this virus. If we all continue our efforts, we'll win this battle together. We need everyone to do their part and to show solidarity. That's why we're launching today a new tool for volunteering that will help citizens and organizations to get in touch. We're counting on you to create a wave of solidarity in Quebec. But always in respect of the rules. Wash your hands, no gathering, distancing. We are an army of Quebecers united in the fight against the virus. And our battle plan is clear. The more we limit the contagion, the more we'll save lives. So thank you very much. Je passe maintenant la parole à Jean Boulet.
Jean Boulet is now going to speak to you of the portal. Thank you, Mr. Premier. Hello to everyone. Of course, as we know, we've been repeating it, we are going through an unprecedented sanitary crisis. And in Quebec, there's a network of community organizations that is pretty well developed. But in the present context that we are experiencing, there are human-related problems that have become even more important. People who have handicaps, for example, people who have mental health problems, the homeless population. So community organizations need volunteers to be able to ensure a quality of life and to maintain that social net in Quebec at its present level. There is a very important need There are people who have become available because of what is going on economically. There are people who are over 70 years of age who used to volunteer. And everywhere, I've been told, in every single region of Quebec, there is a huge crying need. And today we are calling out to the solidarity of Quebecers in this context in order to be able to respond to the needs of community organizations and people who are interested. The volunteers and the organizers will be able to meet up on this portal, web portal that we have developed in partnership with the Federation of Volunteer Action Centers of Quebec. Community organizations will be able to have access to it, jebénévole.ca. So people will be able to have access to that site. Community organizations are going to be able to say, my category of services that I cover is the following. Per city, per region, volunteers, anybody interested in being a volunteer will be able to have access to that site, will be able to express their interest. We will constitute a bank of volunteers everywhere in Quebec to be able to respond to our Meals on Wheels, to the needs of people who live with a handicap. It can be the Moisson, Mauricie, Lanaudière, and eastern townships of this world. They have food banks. They need volunteers to set up food baskets in every single sector of human activity. There will therefore be, in the present context, a forum to be able to allow for a good linking up of those who want to help, those who want to contribute, those who feel that solidarity, and the community organization to be able to respond to those needs. So I wish to thank, of course, the Federation for Volunteer Action Centers of Quebec that is going to be working in collaboration with 110 action centers, volunteer action centers that are spread over the entire Quebec network and who will be accompanying community organizations and who are going to be making sure, of course, to respect, as the Premier was saying, the sanitary guidelines that are incredibly important. They have the expertise. The volunteers are going to commit themselves to respect those guidelines, and therefore they will be able to respond while respecting what has to be respected, so using the present situation. Thank you to the Federation. Thank you to the organizations for making of Quebec a progressive society that worries for the vulnerable among us. We are taking care of those people first and foremost. The present conjuncture imposes it on us, and I also wish to thank, of course, the volunteer action centers and all those who will be contributing by volunteering, which is so essential to our Quebec society. Thank you, everyone. Questions? Hello, Mr. Legault. We realize with the text of the Presse Canadienne that there are people who will be taking the help. They will actually be making more money than certain other people. Does it make the $573, does it make it obsolete? Well, first of all, it is important to say that the help with the government help is temporary. So people are not going to be receiving $2,000 per month for the rest of their lives. It's 4 months. And second, I already said so, we have the intention, and we have had for a long time, of increasing those wages of patient attendants. That is why it is part of the reason why we've been having discussions with the unions right now. So there's a lot of scenarios that are being discussed with unions. We're going to try to be fair, but in fact, it was true before, and it's even more true now. We have to increase the wages of those people more than other workers of the government. What about the $573? Well, the $573. The $2,000 that the federal government is announcing is going to be applicable to everyone. People who have to isolate themselves, people who have lost their jobs, people who were independent workers that had a small business that had to close down, etc. If ever, and I want to reassure Quebecers, if ever there are people who are not covered by the federal program, and I don't think that it's the case, but in that case, if it is the case, if it were to be the case, the government of Quebec will intervene. Mr. Arruda, there was an agreement with the Interprofessional Health Professional Federation. For example, masks. Who has to wear the N95 masks and who has to wear just simple masks? There are social workers who want to wear masks. Who is supposed to be wearing those masks? Your question is an important one, but I will tell you that in fact, the people who are going to have to give care directly in a healthcare setting. So, if you have to remove a sample from a patient, get close to them, well, under certain conditions, depending on the act that is made, particularly with an aerosol, people take masks N95 with a visor and all that. We have to understand that our recommendations are pretty much the same as everywhere else in the world. The mask brings about a lot of questions because everybody thinks that by wearing a mask they are being protected. And the use of the mask is different. The procedural mask, for example, is going to be offered to people who will go in a healthcare setting and who have symptoms in order for them not to contaminate others. And depending on the kind, paramedics, for example, who go get somebody, where they might want to have to reanimate, somebody will have the mask N95. So each situation is analyzed to be able to make the right intervention, because we don't want to have nurses or firefighters, police officers infected. So depending on the level of the risk, we will be doing this. Of course, in a hospital setting, specific units where there is COVID-19 are perhaps going to have material that is going to be different from a unit that is not infected. So all of that is presently being done. As the Premier said, everywhere in the world, the usage of the mask has been reserved for the proper usage. Before, the mask used to be all over in the hospital, but now we have to make sure that we are more careful. So nobody, to our knowledge, has not had material, but there were people who were worried because what they saw physically was that things were was a problem with distribution. But there is redistribution being done, and I wish to tell you also is that entire Quebec is doing, like elsewhere, all sorts of orders and requests, and I can't tell you exactly, but there will be a very significant increase of masks. We have even planned on manufacturing them in Quebec as such in the middle long term. But right now I understand that what people are saying is like, I don't see any masks anymore. There are people who stole masks as well. We cannot let those be stolen. They have to be kept for the most critical things. So generally speaking, and I said it, masks in the community, if you're not ill, if you don't have symptoms, it's not important. What is important is physical distancing. And now I will allow myself to mention one more element. Today we're saying we're calling out to solidarity. The word social distancing gives the impression that we won't want people to have interpersonal relationships anymore. There's the web. There's talking to people who are 2 meters away, volunteers. So we have to talk about physical distancing. It's not that people, distance themselves and no longer speak to their families. So I think that right now, and I also wish to say it, another element that I want to take advantage to say, right now, the virus is in Quebec. If anybody thought that it wasn't, just look at the number of cases and the people who are dying. But it's not in Quebec all over in the same place. In Gaspésie, it's not the same as in the Montreal region. In Montreal, it's different. In Quebec, the national director is there, but there's also 18 regional health directors who are looking at the situation of their own territories and who might make decisions, for example, who are going to test, who are not going to test, according to the local epidemiology. So you'll see that perhaps sometimes in Montreal, a certain kind of people are going to be tested, but not in Gaspésie. And it's normal. It's like a patient. We look at the patient, the state of the treatment. We're not going to give surgery to remove the entire lung when there's only a small part that is infected. So you have to understand that we pose these populational diagnoses. So between Montreal and Laval, there are differences. They're the people who are getting screened. So that's what I want to tell you. I allow myself to mention this. Please be assured. One message must be very, very, very clear. We wish to protect and the patients and our healthcare staff. And depending on the risks and how they evolve, we will be changing how we wear the masks or not. But what is important is social distancing. And of course, if a social worker meets somebody and that they are 2 meters away from the person, they can do their intervention. They can work from home. They don't need a mask. But somebody who has to touch the patient, somebody who has to get a sample, somebody who works in an emergency ward, that's completely different. And those situations are being followed by us, the government, but particularly by expert recommendations. And in health at work experts as well, because the employers have the mandate to make sure that their employees are protected. Do not forget, masks are useful in a context of care. But the most important thing, and I'm rambling on with this, I'm dribbling, I know, wash your hands. Even gloves, if you're wearing them, and if you don't wash your gloved hands, it's useless. Anyway, I'm going to stop because I'm irritating people, but there are some people who think that masks are the solutions. They are not. Hello. Dr. Arruda, the facts, the state of the situation. 2 days ago, we asked the question to the Minister for Health, Daniel McCann, on the number of people in the healthcare milieu who were infected by COVID-19. She answered 4. Yesterday, the Regional Director for Public Health of Montreal said that 34 healthcare professionals had been infected. So what is the state of the situation today, and are we right to think that it is health professionals who are the most affected by COVID-19, or is there another group of employment? Right now, there's 46 people, healthcare workers, who have been infected with COVID-19. I wish to say one thing. There are healthcare workers who traveled. It doesn't mean that the healthcare workers got it while they were working. They might have gotten it when they traveled. We are analyzing those things right now in detail. But what I can tell you is that usually I have had no information that there's been any cases of transmission of a different kind. And healthcare workers, they also walk around in the city. They can be affected even in Montreal if there is community transmission. So I think that's important. But it is as we go forward and we get more specific information on every case that we will be able to show what the individual profiles are. But there are individual workers who know they're just not at the hospital. They go home, they go to the pharmacy, they go elsewhere. So right now, it's mainly within the profile of people who came back from traveling. Monsieur Legault, for the emergency, there are many patient attendants who said, why go on the front lines when I could just stay home and be safe and get $2,000 per month for 4 months? There are also people with who receive fewer wages are thinking the same thing. Do you think that there will be collateral damages of this measure from the federal government? No. And it's the same answer that I gave earlier on. First of all, this is temporary help to help those who have lost their jobs. So you have to see if it's applicable. Secondly, we are having discussions, and we have been saying it for a long time, we want to increase the wages of patient attendants. It's always been part of our proposals with the unions, and we are trying to go forward on that. That is one of the reasons why we are trying to accelerate these discussions with unions. I'd like to come back to the question of medical equipment. You said in the past few days that there were enough in Quebec to protect employees in the health network. You said early on, however, that they have to be used judiciously, the masks that we have. We continue getting emails, dozens per day, of health professionals, whether they be doctors or nurses, who are at the front lines in hospitals of Quebec and who are being told that they cannot wear masks. Could you please tell us exactly what guidelines you are sending to hospitals, who has the right, who does not have the right to wear masks, and why did you want that, at the bargaining with the public sector that is being held right now? There's been cases for the hospital gowns together, for nurses, for example. Well, first, medical equipment and bargaining have nothing to do with one another. Now, when we say how much you have in your inventory for how many days, it depends on the usage. what we can see right now is that in certain places, the usage has exploded, and there are certain places where masks were used where it was not necessary. That is why it is important. I understand that there is staff that can be concerned, and then they do more rather than less. But as in every country in the world, there is an inventory, and it is limited. And we must make sure that we do not overuse them, because if we use them too much, well, there's a greater risk that we won't have them when we need them. So it's important to follow the guidelines that have been given. If you'll allow me, the guidelines given come from the nosocomial infection experts in Quebec, who want to protect the staff first and foremost. When we send guidelines, right now we have respected their guidelines, and we even ask the questions, if we were to not have enough masks, let's say that we don't have any more N95, can we sterilize them and reuse them? There are all sorts of questions being asked, and people elaborate those scenarios. But what I can tell you, maybe it happened at some point where they could see the reserve at one point that was decreasing, but to my knowledge, there's been nobody who had to intervene in any case. I'm not talking about people who think that they're going to intervene tomorrow, or that they are in a unit where they might be scared of not having them, or that did not have access to the material. If a situation like that happened, I would like, first of all, for somebody to tell me. And also, we're very tight with the way we manage it, because if we didn't do it, I can tell you that for all sorts of reasons, even people outside could come in, take masks, and then we really would have problems for people. And at the same time as we are doing this, in parallel, we are working at being able to respond to the need to maybe not have to have that tight management. But the recommendations don't come from us, who after, I decide, I have these many doses and I'm going to choose these people. No, it really is a risk analysis that was done by the Institute. They send us the information and we take care, Ms. McCann's teams and those who work on that, we make sure that we have the material. You said yesterday that there would be no layoffs in the public sector in state employees, but you've already evoked a scenario that would go, for example, to the closure of schools until December. Would there not be, are you sure that there wouldn't be layoffs, even if the pessimistic scenario would happen? Right now, there is no scenario of laying off or not paying employees that work for the government of Quebec, including networks. No scenario. Dr. Arruda, is it normal? Because you said that there was equipment and we have to use it. I want to come back to that. I know that, I've been talking about it for many days, but is it normal that there are doctors that make their own visors with pieces of wire and things like that? My answer is no. And first of all, I want to know whether they need it for the patient that was there. I'm here. I'm stuck here. But if there's that kind of situation, we have to be told. We have to the doctors have to be able to get the material. If it happened in a place that somebody didn't do the actions, no. But it's not normal that doctors take acetates to be able to create visors. But if it happened, I would invite those doctors to contact their CO in their COs as such, and will correct the situation and retransfer visors from one place to another. You are setting up a system of testing everywhere in Quebec. Are we at 2 speeds right now? Because in certain regions we have answers in 24 to 48 hours, and in other places it takes up to 10 days to get results. We don't have a 2-speed system. Our objective is to go as quickly as possible. It might be normal that somebody who is in a region, for example, Gaspésie, had a test, maybe they had it before because there was an important backlog depending on when the regional test happened, because now you have to also understand that, of course, in the Montreal region, there's a lot of cases. And we're going to have to activate certain things. That also means mobilizing all sorts of people to conduct these investigations, because just compared to yesterday in Montreal, there's been 179 new cases. I'm not saying that these people are going to die, but we have to investigate to know who they came in touch with. And that is why, it's not a 2-speed system, but it is possible that in certain territories, certain people will be tested who won't be tested in Gaspésie because it's not pertinent. But be assured that right now there might be a backlog. The main objective is to test, and of course we want to have the results as quickly as possible. I've been told that the target was between 24 and 48 hours, but perhaps there's a backlog. We'll be checking that on a daily basis because that is what we're targeting. But at the same time, if you'll allow me, we prefer testing the person at the right time, isolating them, even if they have to wait 3 or 4 days, rather than not testing them. So anyway, I'll stop here because I think that I'm talking too much or for too long. My answers are too long for, questions that can be answered more quickly. I'm trying to be careful. There's a company, technological company that has access to hook up people's cell phones to connect them. And we consulted that company, and it shows that there's a lot of people who, despite the confinement measures, that are going to touristic areas, particularly in the Quebec region. It seems to be the place where people are walking around the most. And the Plaine d'Abraham, not only do they not have fewer people, they have more people. Do you have the intention of using geolocalization data that is available through those companies to be able to monitor places where Quebecers go in confinement measures and intervene? I can tell you that there's no question of using personal data. That's very clear. Now, the Plaine d'Abraham, if people go for a walk more than usual on the Plaine d'Abraham, if they remain 1 or 2 meters away from one another, for me, it's not a problem. Another question, there's more and more people, business owners, etc., who are asking to postpone GST and provincial sales tax payment installments. Yes, are you thinking about doing this? Yes, we also collect the GST for the federal government, as you know, so that is part of the discussions that we're having with the federal government. Patrice Bergeron. Hello, gentlemen. As you said it, Montreal is not the hotspot, and then you said there were particular measures coming up. Isn't it time to do what China did? They closed down entire regions. Shouldn't we close down Montreal or neighborhoods? We mentioned that we wish to avoid interregional traveling. With that in mind, as far as the action plan that will be done in the course of the next few days, we are analyzing all sorts of scenarios. We're not China. We don't have the same culture as China. We have to make an analysis of what is happening. But if we have to take certain measures, with public transportation or certain neighborhoods, we will do what we can do. I am discussing this with Dr. Massé, who is here to help me, with the region of Montreal. So it's possible that we will recommend to the Premier tomorrow or the day after or the following day things that would be feasible and pertinent and adaptable. But if you'll allow me, before that, what I would like to say is what is even most important, as we keep saying, in the region Montreal, where there's more cases and more potentials of acquiring the virus, is to apply the measures that we're telling you. It's even more important in Montreal. I'm not saying that people in Gaspésie shouldn't do it, but it is really important. And if you are in Montreal and you are in a cottage elsewhere, well, if you're infected, you might risk, exporting it. So this time where we're saying, we're taking a break, we're on pause, it helps us have control over the situation. But we are monitoring and we'll take the appropriate measures. Maybe it wasn't short enough, but I'm trying to improve on a daily basis. You'll be able to time me to see how long I take to answer every question. Concerning still patient attendance, it's often people who are in the private sector that have a problem. They would certainly make more money declaring themselves on unemployment rather than going to work in very risky conditions. They want a decree to equalize working conditions. Is that something that could be thought about? Well, people in the public sector, we hope that it would have a domino effect on the private sector. Of course, if we don't want for rent to go up, the government has to bring an additional contribution. That is part of the scenarios.
J'aimerais vous entendre plus précisément sur le nombre.
I would like to hear you on the number of cases in intensive care. If we take a projection that was done by the Department of Health for the 16th of March for the date of the 25th, which was yesterday, we're talking about 1,600 confirmed cases, so we're pretty much spot on. 225 patients hospitalized, and now that proportion about 5% in intensive care. So we realize that there's fewer patients hospitalized, but that the number of patients in intensive care is much higher than what had been considered. Is that something that concerns you? Have you reviewed strategies? Well, in fact, what we had thought the most is to have the capacity to treat patients in intensive care, to not end up in a difficult situation. The other element is that it's normal that at the beginning of a situation that we observe more severe cases because they get to intensive care. So let's be very careful when you calculate proportions when you're at the beginning of something. That was true in every scenario that we made for infectious diseases. The beginnings of estimates are very difficult because we have not yet reached any stability. We don't have data on every existing case. So maybe there's people, a lot of asymptomatic people, and we never realized. Right now we are keeping an eye on things, but it's not projection that we're looking for. We want to make sure that we can treat patients adequately. If we made a mistake and we have more than what we thought on that date, it's not important to me. What is important to me is that we be able to treat them. In Ontario, Public Health has a registry that is published on their site where we really get the detail of each case. Each case is numbered. We know the gender, the age of the person, not where they live, but the city, the region. And we can even see whether the person is hospitalized or in voluntary isolation. We also can know whether it comes from traveling or a case of community transmission. Why don't we have that kind of registry in Quebec? Would that not allow us to calm down people's concerns about community transmission? Because that is what worries people quite a bit. I'm going to go check the case in Ontario, but we have an issue here that is very important. It's the Commission of Access to Information. When you identify the name of the person, the age. But even if it's not the name, if you're in a small village and you have the age of the person and you have certain information, in Quebec, when you're below 5 in a territory, we don't give. And the land list, the case by case, has a certain level of pertinence. But for us, and I will tell you, even myself, I don't necessarily have the same information than the other health directors. We do have a principle of confidentiality. And there are countries that could present to you the map with the numbers of, pregnant women infected with Zika in Brazil. But our laws don't permit that. However, what is important for us is to intervene. And now I'm going to check. There are software programs that would allow us to do that. But right now, we can act the same. We can have the same action without making the information public. The people who have to know, but we're not going to put it on our website. Last question in French. Mr. Legault, is there a question of making electricity free during the crisis? Not for the time being. Do you expect that CEGEPs and universities be ready to start their activities as of Monday? Well, we wish it online. Is that they be able to give online classes so that people be able to get their diplomas for the session that was very advanced. Don't forget that in CEGEPs and universities, it ends before primary and secondary schools in April or May. So there was a part that has to be completed by online courses. We hope to be able to do it pretty much everywhere, but anyway, there are universities that already do it, universities that will start doing it, same thing with CEGEPs. Thank you. English.
Good afternoon. You've been repeating since the beginning of the week that there is enough protective equipment, but then there is a tight management of the protective equipment, and you said that there were some challenges with the distribution. What's the word on the street, since we do hear people on the front lines saying that there are issues with protective equipment? Again and again, we hear this, running out of sizes, not having what they need, and this is happening like in real time. So what are you doing specifically to ensure that we don't hear those stories again from healthcare workers?
I understand. I think from what I have as information, there has not been a place where we put at risk somebody. There is no masks everywhere as it was used to be, okay? For a reason. And that's the same thing all around the world. There is a strict management of that because we don't want to be in a situation that in 3 days there is no more mask and we cannot protect the emergency people who see that. But it's clear that even in an hospital where there was masks before, they have been taken away from those places where will no have exposition right now to be used in a safe way. At the same time, we're working to augment, to come back to a massive mask distribution everywhere now, because we want to make sure that the ones who need to have it will have it. And if there is an issue with an hospital, tomorrow they won't get any more masks for their emergency or the places where the risk is there, we're going to take masks from another place and send them. It's a tight management because the resource is crucial, but we must use it where it is to be used as recommended by our experts.
Mr. Legault, since you send this message to people that are 70 years and under, that are in good shape, that can become volunteers, but now we receive emails from business people saying, wait a second, I don't get it. My premier is asking me to close my business, but then he's asking me to go outside and do volunteer work, so it doesn't make sense for them.
Okay, but for me, it makes sense a lot. Right now, we have people who lost their job. They don't have the money to get some food for their family. So what I'm asking Quebecers is to please help, if you can, to deliver food to the people that need, that don't have money to buy food. So I think there's a difference with a non-essential business for the next 3 weeks and feeding the population. I think it's essential that everybody get some food. Some people don't have the money to buy the food, so that's why I've asked Jean Boulet to put in place a web, how do you say that, a site web, whatever, to make sure that all organism who would like to have more volunteers, that they can say, hey, I'm needing volunteers, and also the people that are ready to become volunteers, if they have a salary or if they don't have a salary. Some have a salary right now at home. So we are asking them to please help the people that cannot have enough food.
If you allow me to do so, it's got to be looked at on a case-by-case basis, of course. Someone who's laid off, who has the capacity to find a replacement job, of course, this person can integrate the labor force. But in many situations, people will want to show solidarity towards the Quebec society. And you know that we have a very sophisticated network of community organizations. They have many needs. They have increased in terms of taking care of handicapped people, people who are elderly, or people who have don't have the capacity to take care of themselves. So they can, in this situation, they can go to the website and look at the needs of those community organizations and volunteer, depending upon their situation. But we have many needs, and we have to help community organizations to take care of vulnerable people, poor people, and people who have handicap.
Pour le bénéfice de tous, Monsieur le Premier ministre, on me demande...
For everyone's benefit, I am asked whether it would be possible to repeat your answer in French, to know whether there's a contradiction between the fact of asking people to remain home and then asking them to volunteer. What we've done up until now is to close businesses that don't offer products or services that are essential for 3 weeks in order to avoid the spread of the virus. However, on the other hand, we have people who have lost their jobs, who no longer have an income to buy food for their families, who need to go into food banks to which we are giving money. Now, to be able to serve those people who need food, we need volunteers. The other thing that we need, of course, and I said it in the previous days, all grocery stores are looking, or many are looking for people to deliver merchandise to people 70 years and over, for example. So it is normal that on the one hand we say, please don't go work selling, boots or coats, but please do work as a volunteer to help out the people who can't feed themselves anymore because they don't have food. I see no contradiction. On the contrary.
We have a few questions sent by email. The first is from CTV. We are hearing the intensive care unit is approaching capacity at the Jewish General Hospital. So what happens then?
In fact, we must understand that we have other places than Jewish place. We decided to concentrate the initial phase at this hospital, but we have a lot more intensive care beds that can be used, and it was normal that we knew at a certain level to go elsewhere.
And we are currently in phase 2. Please outline what phase 3 of the plan to deal with patients that need hospitalization.
It is essentially issues related to augment the capacity and develop more places. Like we can transform what is not an intensive care unit habitually by specific rooms with ventilators, I would say, for them. So that's only related capacities about taking care and having different places.
And now question from Philote, Montreal Gazette. How bad is the outbreak in Montreal's West End? Do you think it's time to put a quarantine in Côte-Saint-Luc now?
As I was telling before, we are actually doing the analysis with the Director of Public Health of Montreal and see what could be applicable to lower the risk of exportation. But as I was telling you before, try to minimize, if you're not from that place, to go over there. From other regions, but if we need to add other things to do, like in relation with transport and everything, we're going to do specific actions in the next days. Perhaps not tomorrow, but we are following the situation day by day.
Second question from Mr. Autier. We have had 4 deaths in 24 hours. Would you say the situation is under control?
The situation is under control. What we see is what we thought. It's almost elderly people, and some have been exposed to people coming from travels. But please, now, try to not contaminate them by going outside from Quebec and getting into houses. It's not easy. We understand it's difficult for families and elderlies, but it's a question of life or dying.
And now from Raquel Fletcher, Global News. For many renters, the deadline to renew their lease is April 1st. What do you say to renters who are worried about making their payments and are worried about rent increases?
First, Mr. Trudeau said yesterday that about everybody will get $2,000 a month, so it should be enough to pay the rent. But there's a question of matter of days. Between April 1st and the time you get the first check from the federal government. And we're already looking at some alternatives if the checks are not coming soon enough.
And our last question, again from Raquel. With the measures you've announced today, what do you expect to be the impact on the economy? Can we escape the worst case scenario?
I didn't announce any new measures regarding the economy today. We know that the economy is suffering, so that's why we're getting ready. As soon as we'll see the light at the end of the tunnel, we'll have a package to help restarting the economy very rapidly. I've got a meeting at 2 with about the economy.
So that's all the time we have. Merci tout le monde. À demain.
Thank you, everyone. See you tomorrow.